Hello and welcome back. So today we're going to do the resolution for the first case study that we put out here with Shade Tree Cardiology. And we'll jump right into it. A quick review. This was a 73-year-old male who presented with near syncope after a vigorous church service, which did involve some physical activity. And the monitor interpretation gave us an ST elevation criteria met message. So the diagnosis at the ED went as follows. The troponin, CK and MB, all these values were within normal limits. Referral to cardiology showed that there was deposits of atherosclerotic plaque present, probably a long-standing problem there with subsequent stenosis of the LMCA, but it was pathologic, but it was non-critical, so it wasn't necessarily producing violent changes. He was orthostatics positive at the ED, and was kept for observation for around 4 hours. And then the patient was discharged feeling better after some fluid resuscitation and basically just rest, told to follow up with the general practitioner. Now, the diagnosis is half of it. The prognosis is the other half. And this is something that if it's someone in your community or you're going to see this patient again, these are things you might be looking out for. So this is someone you would probably expect to see develop occlusion of the LAD or LCX or even LMCA stenosis further if they didn't have some sort of lifestyle changes and proper medical management after this. You could also see, widespread subendocardial ischemia or even pinpoint subendocardial ischemia, or what's otherwise known as NSTEMI in the future. And this is usually a pretty common thing when it comes to occlusion or stenosis of the great vessels. The subendocardial vessels are the furthest point from the ostia of the aorta where the great vessels of the heart actually come out. So this is going to be sort of the place that it's hardest for the blood to make it to because of the pressure, of course, that's inside the endocardium, your preload and afterload, the actual pressure the heart is generating, as well as just the lowered pressure from hose friction. Here's Poiseuille's law in action for you guys, as well as the hose friction sort of cutting down on the amount of pressure that one can get. If you have an occlusion in the larger vessels or stenosis in those larger vessels, you can expect to see a, very noticeably lowered pressure at the smaller vessels, if that makes any sense. So for this one, this is definitely a heart patient. This is someone that is eventually going to have a pretty extensive history without some social changes and without some medical management changes as well. So this is the kind of patient where diet and exercise would definitely make a big difference. We tend to focus a lot on the emergency management of patients like this, but the real money is going to be made, so to speak, at the primary care provider's office. This person working with their GP to adopt and live a healthier lifestyle to slow the heart disease that they already have. All right, if there's any other questions, just put them in the comments. And if you like what you see, just consider subscribing. Thanks a lot, guys. Get out there and practice.